things were a lot more hands-on. We had to make all our own reformats. We had to grow the vessels for all the CTAs. Everything was done by us. Now they're more computer-oriented as far as the machinery and how we deal with the patients. There's a lot of things that the machine does for me that help me to not get things wrong. You just have to tell the pictures where you want them to go, what protocol, and it automatically splits them for you. Prior to that, we had to do it afterwards. You'd pick a set of pictures and send it to the neck, or you'd pick a set of pictures and send it to the chest, abdomen, pelvis. It's really helpful. It gives you a list of protocols to pick, and you pick what you want, and you're on your way. It makes it so much easier for the patients too. They are shocked when you go back in the room and you say, okay, we're done. It's really a good thing because they come in for their appointments and they're expecting to be there half hour, 45 minutes. And in 10 or 15 minutes, we're done. They appreciate that because then they can get on with their day. It's important for the speed of the machine and helping me. The phone's ringing, they want to add on extra patients, which is doable because the machine is so fast. We have to deal with squeezing patients in from the ER, house patients. It's a lot to juggle, but because the machine is so much faster, it takes so much less time to scan a patient, we are able to squeeze those patients in.